Welcome back to another episode of What to Expect When Being Placed on Hospice. Today we're going to cover COPD, chronic obstructive pulmonary disease. Now, like I said in other videos, this is a chronic illness. So many people come on and come off hospice with this disease. So this is one diagnosis that a lot of times people graduate from hospice and then later will come back on if they have another infection or an exacerbation of their COPD. Okay, so what to expect when being placed on hospice for this disease? So there's a few symptoms we usually always see in someone with COPD at the very end stage, and that is shortness of breath, persistent cough, and intermittent infections. And then, of course, towards anyone's end of life, you see the normal things with everybody, which is decrease in food and water intake, decreased functional and mental status, meaning it's even difficult to get from the chair to the bathroom without feeling really short of breath or really tired, and increased in sleep. So what can we do about these things? Again, if you are someone who has COPD and are already on hospice, of course, you want to always work with your doctor and your hospice agency. I am just here, Hospice Nurse Julie, to educate. So please, if you have any questions, please always ask your doctor or your hospice agency. Okay, so now that's out of the way, what can we do? So usually someone with COPD is already on oxygen. So they're on oxygen, they probably have inhalers and a nebulizer machine, or one of the other. They're probably on daily or intermittent steroids. This just helps with the inflammation. And then, of course, I love Roxanol for COPD patients because a lot of times they have that feeling of air hunger where they feel like they can't breathe, and Roxanol will really help with that. And then again, like any patient on hospice, I always say, let the patient be your guide. So as long as they're clean, safe, and comfortable, we're good. If they aren't, call your hospice agency. Thanks. Let me know if you have any questions.